After Florida's Surgeon General said he was removing all state vaccine mandates, including those required for children to attend schools, more states are deciding to go it alone on vaccines. Officials in California, Oregon, and Washington are banding together to provide their own vaccine recommendations after Health Secretary RFK Jr. replaced CDC's advisory panel. 8 states in the Northeast, are doing something similar. What's clear is that the U.S. is headed toward 2 very different vaccination realities. Joining us now, Florida board-certified pediatrician Dr. Mona Amin. Thanks for joining us.
Thanks. Yeah.
If I'm a parent in Florida and I want to get my kid vaccinated on the schedule that had been recommended by the CDC, am I able to do so?
Thanks for having me. And I am a pediatrician in Florida, and I'm a mom myself. And as of now, you are still able to get vaccines. But this announcement, this news conference, is highly concerning because it's leading a path to removing the mandates in school systems and in daycares and group childcare settings, which has protected so much of American children in Florida. And this is a concern not only for those children, the families and the communities that rely on vaccine programs to keep us safe and healthy.
So if the recommendation panel changes the recommendations broadly at the federal level, is my insurance going to still pay for these vaccines?
That's a huge question. And right now, this is happening in Florida, right? And you just said it perfectly, that this is now becoming a civil war of public health. You're seeing states on the West Coast, you're seeing states in the Northeast, and then you're seeing a state like Florida make very different decisions based on their public health beliefs. And a lot of the red states that we're seeing are not aligning with public health policy. So if this was to become federal, which it's hard to say if that will ever happen, it's really hard to know if insurances will cover the vaccines. And that is my biggest concern in Florida. If it's no longer mandated, if it's no longer recommended by the CDC, what will happen to the insurance coverages? And so many families rely on that. And that is why vaccines are free for families and they have no cost when they get them.
So one of the other wrinkles that I didn't consider until today was, your kids, when they're young especially, are on a vaccine schedule. So you only get fully immunized after many years. If you are a parent that is deciding to get these vaccines, but you also have to put your kid in a daycare or elementary school, you're not going to homeschool them. Maybe you don't have the option to do that, to keep them away from other kids at all times. How do you keep your child safe if they haven't been fully vaccinated against measles or rubella or whooping cough? How do you make sure that they're going to be okay at their daycare?
And this is exactly why these mandates are scary. And it's disheartening because we know the power of vaccination. We know the power of herd immunity. And this is a term that I think a lot of parents need to understand, that when we vaccinate communities, we help the entire community. So we protect those children that are newborns that are not able to get fully vaccinated. We protect those preschoolers who are going to be in a group childcare setting who are on schedule but are not able to be fully vaccinated yet. And we protect the immunocompromised children whose bodies are not able to get vaccines because they're not able to mount an immune response. And so as a parent, this is going to be tough decisions of, am I going to send my child to childcare? I think in this time frame, advocating, calling Florida legislators, calling local legislators is really important so that we can express the importance of mandates, so that we can protect children, so that we don't have to make that hard decision of, do I have to now not work because I have to keep my kid home because I'm afraid to send them to a childcare setting where they're more at risk for vaccine preventable illnesses, or how am I going to navigate this? So one of the best things we can do is make sure to vaccinate all the people around your child, family members, siblings, anyone in close contact. That's going to be the best thing, and hopefully we can reverse this decision and not make it law.
All right, Dr. Mona Amin, thank you so much for being with us. I appreciate it.